Thank you, sir. So, to go with the topic, the bone disorders in tropics. I'll start with the background of the tropical zone. Where do we stand in our country? The tropics, the real tropics, which starts from the which consists of South America, Africa, and the Indian population, and the South Asian population, and also a group of Australia, where we do are fortunate a child, and where do we get abundant sunshine. But whether this abundant sunshine gives us any difference in bone disorder in tropics, uh, do we have a different phenomena? So I must sincerely thank Dr. Ankit for introducing such a protean manifestation of primary hyperparathyroidism. But having said that, probably the primary hyperparathyroidism, if we context think about the bone disorder in tropics, still it should go in the later phase. And in this seminal study, where we can see that approximately around 22 states of India, where multiple villages were reviewed, and where approximately 4 lakh patients were seen with the bone disorder metabolism. Approximately 52% had nutritional bone disease, and 43% had endemic skeletal fluorosis, and 5% had metabolic bone disease, and only 0.19% had the rare bone disease. So to start with this, therefore, I go with an agenda of where I'll talk in the next few slides in these few points of spectrum of vitamin D deficiency, where we stand today in spite of abundant sunshine. Then I'll touch on the endemic sclerotal sclerosis. Then I'll discuss on some about the osteoporosis, about the parathyroid related disorders, chronic kidney disease, and other chronic diseases associated with metabolic bone disease. And finally, we go in the take home message. So, where we stand with the spectrum of vitamin D deficiency? If we go with this slide with the vitamin D status and sun exposure in the Southeast Asia, we can see from this slide that in the China and South Korea and Thailand, comparable to our country, we can see that China, of course, stays in the temperate zone, where the prevalence of vitamin D deficiency is quite high, just like our population. And South Korea is also having almost similar form of vitamin D deficiency. But then Thailand goes a contrast feature where the prevalence of vitamin D deficiency and insufficiency is quite low. Our neighboring countries, the SAARC associated countries like Pakistan, having a high prevalence of vitamin D deficiency in spite of abundant sunshine. Bangladesh and Sri Lanka has also got a similar prevalence. When it comes to the Indian population, this systematic review has clearly shown that probably the mean vitamin D concentration is very much lower in the Indian population. Of course, South Indian probably scored somewhat marginally better in the range of 70.45. This key study by Marwa et al. Has shown the regional and seasonal variation in the UV radiation and vitamin D synthesis in India. Of note that there is important point that there was no increase in the serum vitamin D level following sun exposure during winter, as the ultraviolet radiation was significantly low, emphasizing the need for vitamin D supplementation during these months. There, I want to note one important point in the results, that the readings in the northeast zone, the northeastern part of the country, probably because of the cloudy weather in the longer period of time, in the longer period of season, have got a lower level of radiation throughout the year, while the other seasons, if we compare. And there is increased need for the vitamin D supplementation in the winter season. But then the contrary to this point, when this study from the Guwahati in the vitamin D status of school children in and around Guwahati, it shows a surprisingly very low level of vitamin D deficiency of approximately 8.4% or around 14% of vitamin D insufficiency, which gives us a contrast feature. But having said that, probably we are in a very much premature state, that probably the northeastern part comes just near to the Southeast Asia or like Thailand, like a picture where the vitamin D deficiency probably a bit low in comparison to the other parts of the country. And when we come to the just nearby state, our Bengal, where we can see that approximately 70% of the population suffers from vitamin D deficiency or insufficiency in spite of high amount of fish intake. We know all this has been described by Dr. Rana Bhattacharya sir regarding the manifestation of nutritional deficiency and bone disorders. We know the features of rickets, short stature, low bone mass in genu-valgum and other bone deformities, and adults the features of osteomalacia. So where do we stand with the endemic skeletal fluorosis at this point of time? These are the points where we know that when depending on the different range and when the cutoff range crosses the reference range, the dental fluorosis, mottling, pitting of the teeth, and the prominent evidence of dental and skeletal fluorosis comes. The evidence of endemic skeletal fluorosis, we can see that it has been reported since the 1971, where of course this study has reported that probably it was first described in India since by the state of Madras by Short et al. In 1937, and subsequently it was described by many other authors. Of note that definitely the fluoride level concentration is can be seen in different food products. Whatever the food we are taking in day-to-day basis, apart from high amount of fluoride content in different parts of the country in the water level, also different forms of beverage like in teas and green teas, and also important to note that the real fashion these days to use the rock salt and aerated drinks and the coconut water. So much so that probably this is highly prevalent in our country. But having said that, the key journal which we follow, Journal of Clinical Endocrinology and Metabolism, probably there the skeletal fluorosis from brewed tea becomes an important case report, but definitely it is not for India, where we can see that this type of picture where it is highly prevalent in different parts of the country. Of course, the mostly affected are Rajasthan and many parts of southern part of India, some also in the few parts of areas. Where do we stand with osteoporosis these days? In the post-menopausal osteoporosis, which is a highly predominant scenario in the West, in India, probably the prevalence of osteoporosis varies between 25 to 62%, and therefore, where we are different in the osteoporosis. This seminal paper, again, starting from 1996, shows that probably Indian males are just equally comparable in the osteoporosis prevalence and incidence in the females, where in the West, probably the post-menopausal females are the most sufferers in the phase of osteoporosis. Again, the higher male and female ratio suggests that Indian males need attention in the higher risk of hip fracture, and this table also shows that the average age of diagnosis since in the 1996 it was reported as age of approximately 55, with quite younger age to suffer from osteoporosis. Probably to describe that that osteoporosis also affects quite a lot in the Indian main population and quite younger age. And the crux of the theory comes that probably the nutritional deficiency, the decrease in the calcium intake, also cause one of the important factor which has been highlighted by Dr. Rana Bhattacharya also earlier. And another important notice that probably some contrary belief that the vegetarian, those who are strictly vegetarian, they do suffer, they do have got a good vitamin or the mineral bone content in comparison to the non-vegetarians, probably because of the higher acidic load in the non-vegetarian diets, and therefore the reduction in the bone density and higher risk of osteoporosis in non-veg group. So again, this important epidemiological study where a report from the International Osteoporosis Foundation, I just want to highlight that the incidence, if we see in this cartoon, the uh, incidence of hip fracture in a particular area of the Indian subcontinent, where we can see that the incidence of hip fracture in males probably it comes if it is more than 75 in the range of around 400, or in cases of female also approximately 400. And in the similar way, the vertebral fracture has gotten bimodal distribution. But when it comes to our neighboring countries like China, Hong Kong, Japan, South Korea, or Taiwan, where we can see that probably the incidence per 10,000 comes in 87 or 83 or maximum in the range of 90, where in our country it comes around 400 or 600, showing the burden of the disease even in the male population. And then again, add to this burden, the diagnostic availability of DEXA scan and ultrasound is a rare phenomena in many parts of the country, and also the treatment availability and reimbursement in the form of bisphosphonate, in the form of teriparatide, in the form of vitamin D, or even the calcium supplementation becomes a real matter of debate. So going to our next hot topic of parathyroid related disorders, where we discuss a case presentation today. If we go to our own Indian PHPT registry, where we can see that probably till date, the important manifestation, the way our PHPT patient present are important one is the bone pain, and then the history of fracture, then the history of renal stone disease. And how comes the biochemical picture? We can see that definitely there is some difference in the form of the calcium level in the symptomatic PHPT and the asymptomatic PHPT patient, where you can see that the symptomatic PHPT patient has got a higher level of the calcium level, and definitely there is extremely higher level of the IPTH level in comparison to the asymptomatic PHPT patient, and definitely they have got an increase in the tumor weight. And when we compare to the experience from our neighboring country Pakistan, we can see again that the renal manifestations are quite common, just like our country. Also, the muscles and bone pain. However, the asymptomatic hyperparathyroidism is still reported as around 22%. And this is probably the changing scenario over a period of in India over a period of 20 years, where we have got prominent. Our one of the panelists, Sanjay Kumar Vadada sir, will be discussing on this talk on this point of changing scenario of PHPT, and just highlighting here the bone pain as the important necessary points. And then here I want to highlight in this slide that probably these days, if we contrast to our neighboring countries and just nearby countries, we are probably in a changing phase of PHPT, where we can see that even the asymptomatic PHPT patient report is now coming around 40% of the population. If we go to a 5-year retrospective analysis, probably this comes and this highlights a changing scenario of the PHPT reporting. Just going to the contrast and a bit a rarer variant of parathyroid related disorders, where we can see that idiopathic hypoparathyroidism or pseudohypoparathyroidism probably gives us a more of a neuromuscular manifestation along with cataract and dentine abnormalities. And we do have the radiological findings in the form of intracranial calcification, thalamic infarct, or nephrocalcinosis. Of note, here we want to highlight that in idiopathic hypoparathyroidism, there is increased in the carotid, aorta, or renal arterial in the intima media thickness, probably, which is why probably the vascular risk is increased in this group of category of patients. So where do we stand with the chronic kidney disease and other chronic diseases associated metabolic bone disease? Up front, we want to say that if we want to see the different parameters of chronic kidney disease and the spectrum of the bone disorders by which the metabolic parameters manifest, the most important manifestation is probably hyperphosphatemia, then hypocalcemia to some extent, and also the secondary hyperparathyroidism. To report the tertiary hyperparathyroidism is still a bit low, and we are in a changing phase because these days we know that type 2 diabetes mellitus is a very much important cause, and we have got a big burden of type 2 diabetes and diabetic nephropathy, whereby it manifests as chronic kidney disease, metabolic bone disease. But having said that, the typical manifestation of osteitis fibrosa cystica and other myriad bone disorders are probably these days rare because of our large biochemical parameters monitoring and thereby management. Having said that, to talk on this important and related discussion, just to touch on all these points in a short time probably is not possible, but also these are the few points also catches my mind where we should also have a point that the severity of osteoporosis and the diagnosis of osteoporosis also need introduction in presence of other secondary causes like different chronic diseases, like different other endocrinopathies. Then the over-the-counter use of steroids, corticosteroids for different uses even by the pharmacies, or over-the-counter use of the steroids for weight gain, so which can cause drug-induced bone disorders and also can lead to osteoporosis. And definitely we are not in this that we can say that Paget's disease is extinct. It is also still reported and still exists in India. Then again we have got the different rituals in the form of fasting and starvation and malnutrition. So evidence for the adverse effect of starvation on bone quality is also important, which should be highlighted. So just to summarize and just to get a take-home message in this point that all of us should have and target and formulate an action plan probably to reduce the burden of the nutritional deficiency and endemic skeletal porosis, osteoporosis. We do have a changing and challenging pace of primary hyperparathyroidism in our country at this stage. We do have different other chronic diseases and chronic kidney disease and drug-induced associated metabolic bone disease. Our children are suffering in different parts of the country with this form of disease. They do have, and our middle-aged population also definitely recognizes and definitely needs a better support. This elderly population doesn't require only pension, but also requires improved bone health, which has been shown in our male counterpart also. Definitely with this, we can say that we are fortunate probably as we are living in tropics, and we are probably fortunate in also says that sun rises in the east. But in spite of abundant sunshine, probably fortification is important, and then also along with